statewide newscast. Arkansas Today.
Welcome back. Dr. Ellen Jones from the Arkansas Pharmacists Association is here to tell us how we can combat these pesky insects that we are all dealing with during the summer. We want to be outside, but sometimes it's the insects that are keeping us inside. So what do we need to know to make sure that we can enjoy our time outside?
Okay, well, obviously the best thing is to avoid exposure. So if you could go outside wearing long sleeves and long pants, that's perfect. Oof. Unfortunately, it's hot outside.
Right.
So the best thing to do is find a good insect repellent. So you're going to want to find something that has DEET in it, which has been proven safe for children 2 months and older.
Okay.
For adults, you want to do less than 50% DEET, and then for the younger children, you're going to use less than 30%.
Okay.
You can find lower percentages. You just have to apply it more often.
Okay.
In that case, the CDC has recently added oil of lemon eucalyptus to its recommended product, so that is a more natural product if you're looking for something from a natural source. It is not recommended for children under 3 years old, however.
Good to know.
So you're going to want to spray it all over. You're going to want to spray your clothes as well. So not like sunscreen, you know, but you can put it everywhere because it's the scent of the chemical that it's smelling that detracts the bugs. So that's one way to do that. And then if you do get, if you find a tick on you, so you want to do a tick check anytime you've been outside, high grass, in the woods, look for in your creases, hairline, waistband. That's where they like to hang out.
So any spot that they can kind of burrow.
Right. They like kind of the dark, you know.
Okay.
So if you do find one on you, the best way to remove it is, you know, we don't want to do the nail polish, things like that.
The old wives' tale.
Exactly. You use some tweezers, get as close to the head as possible, and just pull.
Okay.
Then afterwards, once you've removed it, you're going to want to clean it with soap and water, maybe a little alcohol, something like that. And that's all you really need to do.
If the head sticks in there, anything we need to do then?
Call your doctor.
Okay.
See if there's don't go digging.
Okay.
You know, yeah, go ahead and contact your healthcare provider.
And of course, when there are more, you know, if somebody's allergic to an insect, a bee sting or whatever it may be, and you have more serious concerns and maybe an EpiPen, you have a demo for us.
Sure, absolutely. Now, most people are not going to have this allergic reaction. They're just going to have the normal, you know, intense burning if like a wasp or a bee stings you. In that case, you just go to your local pharmacy. You can do an antihistamine like Benadryl for the itching, and you can do like an ibuprofen for the pain, and then ice packs. But if you do have an allergic reaction, then I brought a handy little EpiPen demonstrator here. There's no needle.
It's the first thing I asked.
So what you're going to do with this, and this is important to know, the blue side goes up, the orange side goes down. There's never any reason to touch the orange part with your hands, okay? Because it's a dangerous thing. The medication is in here. This one doesn't have a needle. If you push on this with your thumb and you get that medication in your thumb, you can cause some real problems, okay? So you don't want it to go anywhere but then where it belongs. So what you do, this is the safety. The blue is the safety. So you take the blue off. You hold it in your hand. You don't have to touch the top or the bottom, and you jam it in to the muscle of the thigh. You hold it for 10 seconds, and that lets the medication go from the pen into the muscle. So you hold it like that, and then you let go. If it's worked, then this orange thing will stay out, and you will know. And then you can massage that, then get to the hospital.
Yeah,
absolutely. Get straight to the hospital because you can have a secondary reaction. It's very important.
One of those things that you never hope to have to do, but you want to know how to do it. Thank you so much for being with us. I appreciate it.
Sure, thank you very much for having me.
All right, and we'll have one more check of our forecast when we come back.